Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and today I am going to talk about further clot risk reduced by extending the anti-clotting treatment after a distal DVT. Now, giving the anti-clotting drug Rivaroxaban to patients for 12 weeks instead of the usual 6-week period after a blood clot, especially in the lower leg, it reduces the risk of further clots developing up to 2 years after treatment. This is in accordance to a trial that was published by the BMJ. Rivaroxaban, as we all know it, is an anticoagulant drug. It's given to people at a high risk of getting dangerous blood clots to help their blood clot thicken more slowly. Now, anticoagulation, as we all know it, is known to prevent any further clots developing in patients who already have a blood clot in their leg, including those with isolated distal deep vein thrombosis. But doctors are still not sure whether all patients with the distal DVT should receive anticoagulation and for how long. So to address this particular uncertainty, the researchers set out to compare two different treatment durations of Rivaroxaban in close to 402 adults who were diagnosed with isolated distal DVT. So after receiving a standard dose of Rivaroxaban for 6 weeks, participants who had not developed any clotting or bleeding complications were randomly assigned to receive either Rivaroxaban 20 mg or the placebo once daily for an additional 6 weeks. All the participants were assessed for any new clots or any serious bleeding at 3 weeks, 6 weeks, 3 months and even 24 months, and were all advised to seek medical advice if any new signs or symptoms that potentially suggested recurrent events had occurred. So the results of the trial showed that after randomization, 23 patients in the Rivaroxaban group and 39 in the placebo group developed a further clot either in the lower leg, the upper leg or even in the lung. While recurrent isolated distal DVT occurred in 8% of the patients in the Rivaroxaban group and 15% in the placebo group, while proximal DVT or pulmonary embolism, it occurred in 3% patients in the Rivaroxaban group and 4% in the placebo group. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.